Welcome to our sonography lecture on renal pathology, part 12 of 14, obstructive pathology for the sonographer. This lecture will cover urolithiasis. So renal obstructive nephropathy is the blockage within the urinary tract that can be caused by many things, which causes urine to back up into the kidneys. Now, more often than not, this is going to be some sort of blockage due to stones. Some of those blockages can be uretral where the ureter starts to die off. Abscess can cause a blockage. Lymphocele, which is a sac of lymph fluid. Fungal balls, which are a sequela to infections in the kidney due to fungi. They can create these balls of fungus within the kidney. Retroperitoneal fibrosis is basically scar tissue within the retroperitoneum. You can have stricture of the UVJ, or the uretovesical junction, which is where the ureter connects to the bladder. We can have hemorrhage that can cause blockage. And lastly, a calculus, which is a stone and the most common cause for blockages of the urinary tract. So that brings us to urolithiasis. If we break down uro, we have the urinary tract, lithiasis stone, so stone within the urinary tract. So these stones are also called kidney stones, as they do originate up in the kidney, and as they are made, they can become bigger and bigger and bigger, where they can get lodged anywhere within the urinary tract. Typically, these stones are made out of urine particulate, so most commonly that's going to be calcium. Now, the stones can range from very tiny, and they pass through the urinary tract basically undetected, or they can be a little bit larger where they become symptomatic, maybe are slightly irritating to the collecting system, cause a little bit of flank pain, but end up being passed without too much issue. Or we can get larger stones that actually kind of get stuck in the ureter, stuck somewhere in the kidney, and cause some more pain. Or we can have extremely large stones that fill the entire renal pelvis, and those have a special name, Steakhorn Calculus. Now, it's more common for men to have stones than it is for women, and if you have a history of kidney stones, you're more likely to develop kidney stones again. These patients come in with extreme flank pain to the point where they're nauseous and possibly vomiting, and there's often hematuria or blood within the urine. On ultrasound, we're not super good at detecting the smaller stones. We are pretty good once the stones are large enough to be detected with basically the physics of our machine and to produce enough of a shadow that it kind of catches our eye. So in the kidney or somewhere within the ureter, maybe down at the uretovesical junction or even in the bladder, we will see this echogenic structure, and behind it we should see some posterior shadowing. There's also a theory that if you put your color box on, you can get what we call a Twinkle Artifact, and it's the way that the sound interacts with the calcium of the stone. It kind of makes the sound bounce around in there a whole bunch, and you get this kind of sparkly color behind the stone itself, hence the Twinkle Artifact. Now, if that stone is lodged somewhere where it's causing an obstruction, we're going to see hydronephrosis. And if it's lodged within the ureter, not allowing any urine pass, then we're only going to see one ureteral jet. So here is an example of a stone within the kidney. Again, we have this bright echogenic structure with posterior shadowing. Bright echogenic structure with posterior shadowing. Here's another example of a stone more down into the collecting system. Bright echogenic structure, posterior shadowing. This is an example of Twinkle Artifact. We can see our normal vascular structures in the kidney, but there actually is a stone right here, and we're getting kind of this weird jet of color off of it. And if this was live, it would be like all sorts of different colors. It would look like noise coming off from behind the stone. So that's the Twinkle Artifact. And here is a giant Steakhorn Calculus. This is filling the entire pelvis of the kidney. So we can see the anterior border of it here and then nothing but shadow behind it. This is a gross example of the Steakhorn Calculus. They are made of calcium, so we can see them on x-rays, and you can see how it's just entirely filling the renal pelvis. The right one is much bigger than the one that is on the left. this person is probably in an enormous amount of pain. They're going to need surgery to get these out. Here is a Steakhorn Calculus then completely out of the pelvis. You can see how it takes shape of the calyces and then takes shape of the pelvis and into the ureter. So these are kind of interesting. Most likely going to be seen better on radiographs or x-rays than we're going to be able to see on ultrasound, just because it causes so much shadowing behind it. So again, if a patient is in pain with flank pain, has blood in their urine, there's a good chance that there's a stone somewhere along the track. If you see hydronephrosis within either kidney or a dilated ureter, then there's most likely a stone obstructing the urinary tract, and you want to try your best to find that obstruction. And that is all I have for urolithiasis and obstructive nephropathy. Next up, we're going to talk about bladder pathology.